Hi guys, kia ora, namaste. My name is Dr. Sandhya Ramanathan and I'm a GP in Auckland, New Zealand. And today I just wanted to answer a few questions about COVID-19. The best way to protect yourself if you have a chronic condition such as diabetes, asthma, or any of the autoimmune conditions such as rheumatoid arthritis or SLE, the best way to protect yourself against COVID is to make sure that you have optimal management of your chronic health condition. So that means, for example, if you have diabetes, your sugars are well controlled, you take your medications regularly, you do exercise and you watch your diet. With asthma, for example, make sure that you're taking your preventer puffer regularly and that you are not suffering from any symptoms that would better be controlled by fine-tuning your medication. So it's important that you maintain contact with your GP and you stay on top of your chronic health condition. You make sure you keep on getting your regular prescriptions. Same with autoimmune conditions. It's important to keep on with those medications because it's best for your immunity if your chronic health condition is well managed on the recommended medications. In addition to that, it would be very helpful for you to work on your immunity, and the best way to strengthen your immunity is by a healthy diet rich in fresh, colourful vegetables and fruit, drinking lots of water, and getting an adequate 8 hours of sleep a night, trying to maintain a good routine, and staying connected to your loved ones and staying calm. Although there were some early reports that there may be links with certain blood groups and the severity of COVID-19, this has not been proven, so there has been no link established. So your blood group really has nothing to do with your chances of getting or fighting COVID-19, as far as scientists know up to date. And unfortunately, nobody is immune to COVID-19, so we all need to protect ourselves. The best thing you can do for your health during this COVID-19 pandemic, if you do smoke or vape tobacco, is to stop doing that straight away. This is because smoking and tobacco are very bad for your health. COVID-19 infection, when it gets bad, wreaks havoc in the lungs. Tobacco smoking is very bad for your lungs. Therefore, it is very important for your health generally that you stop smoking and you avoid vaping as well. And if you need any help with getting off smoking or vaping, you can speak to your GP or to Quitline. If you do have cold or flu-like symptoms, it's very important to get medical advice straight away. As I said, you need to stay at home, cough or sneeze into your elbow, isolate yourself from your family members and wear a mask if you are to interact with them. Talk to your GP or to Healthline and they will advise you whether you need to go and get a test for COVID. Anyone can have a bad outcome with COVID. It's very hard to predict. That's why it's very important that we all try and maintain a healthy immunity and try and avoid getting infected, because prevention is always better than cure. The people who do tend to get more severely infected with COVID are the elderly or those with chronic health conditions or those who are immune suppressed. And therefore it is very important that even if you're young, fit and healthy, you follow all the precautions so that you do your part in making sure that everyone is protected and that we together stop this accelerating pandemic. So 3 very simple behaviours we can all adapt are to wash our hands regularly with soap and water for at least 20 seconds, or to use an alcohol gel, particularly before we touch our eyes, our nose and our mouth. That we watch our distance and maintain a physical distance of at least 2 meters where possible. It is very important that although we remain physically distant, we remain socially connected because that's very important for our immune health. And thirdly, it's very important that we wear masks wherever possible and we write down all our movements so that should the need arise, we would be able to tell exactly where we were so that we could rapidly contact trace and help stop the virus in its track.